Good morning, all. Today we are going to discuss about activated partial thromboplastin time, that is APTT. So this test is mainly done to detect whether there is any deficiencies of coagulation factors involved in the intrinsic coagulation pathway. Okay. So before discussing about the APTT, let's have a look into the coagulation cascade. So there are mainly three pathways are there: intrinsic pathway, extrinsic pathway, and common pathway. So extrinsic pathway get initiated by the tissue factor, which is released from the tissue, damaged tissues, that is tissue factors, coagulation factor 3. There are 13 coagulation factors, of which coagulation factor number 3, that is tissue factor, is released by the damaged blood vessel or tissues of the damaged blood vessel. So now, once when the tissue factor get released, it causes activation of factor 7. So factor 7 causes activation of factor 10. So now the factor 10 in presence of factor 5 and calcium causes activation of factor 2. So now the activated factor 2 causes conversion of factor inactive form of factor 1 to active form of factor 1, that is formation of fibrin. So finally, a clot has formed. So the entire pathway, that is extrinsic pathway, factors in the extrinsic pathway and factors in the common pathway finally causes formation of a clot. Okay. So here we can see there are two factors in the extrinsic pathway, that is factor 3 and factor 7. And factors in the common pathway are factor 10, 5, calcium I have in written here. Calcium is a coagulation factor number 4, factor 2 and factor 1. Okay. So the test which is used to detect whether there is any deficiency of coagulation factors involved in the common pathway and extrinsic pathway is prothrombin time test. Okay. So we have already discussed about the prothrombin time test. So today we're going to discuss about the APTT, activated partial thromboplastin time. Okay. So the test detect whether there is any deficiencies of the coagulation factors involved in the intrinsic pathway and common pathway. Okay. That is, here the intrinsic pathway is initiated by the factor 12. Okay. Here you can see factor 12 initiates the succeeding components. Okay. So and then we can say that intrinsic pathway is initiated by the factor 12. Okay. So here what happens is, once when the tissue is damaged or the blood vessel is damaged, it causes exposure of the collagen. So exposed to collagen causes release of von Willebrand factor. So as we all know, there are certain receptors present on the platelet membrane corresponding to the von Willebrand factor in the collagen. So this von Willebrand factor attracts platelet carrying corresponding receptor. Okay. So each of the platelet will go and bind to the von Willebrand factor using glycoprotein receptors. Okay. So now once when the platelet bound to the von Willebrand factor, it causes shape change of the platelet. So once when the platelet shape got changed, it causes release of granular content of the platelet to the surrounding medium. Okay. So the granular content, released granular content causes attraction of more platelet at the site of injury. So now this all platelet will go and bind at the damaged endothelium, causing a formation of platelet plug. This is what we call primary hemostatic plug. Okay. So as this platelet has released its granular content, it causes a formation of negative charge over the platelet plug. Okay. So this negative charge causes activation of certain factors. They are involved in the intrinsic pathway. So the factors which are involved in the intrinsic pathway are causes called as contact activation factors, because this negative charge present on the platelet membrane causes activation of factor 12. The activated factor 12 causes activation of inactive 11 to active 11. So now the activated 11 in presence of calcium causes activation of 9. So now the activated 9 in presence of activated 8 causes activation of factor 10. Okay. So now the activated 10 causes activation of factor 2 in presence of factor 5 and calcium. So now the activated factor 2 converts inactive form of factor 1 to active form of factor 1. So finally a clot has formed. So the bleeding got arrested. Okay. So these are the main factors which are involved in the intrinsic pathway from 12 to 8 and from 10 to 1 coming under common pathway. So here by using APTT test, we are checking whether there is any deficiencies of coagulation factors involved in the intrinsic pathway, that is factor 12, 11, 9, 8, factor 10, 5, 2 and 1 along with calcium. Okay. So let's discuss about the principle of activated partial thromboplastin time. So principle of the test is that the test measures clotting time of plasma after the activation of contact factors, addition of phospholipid and calcium chloride, but without adding tissue thromboplastin. So thus indicates overall efficiencies of the intrinsic pathway. So to standardize the activation of contact factors, plasma is pre-incubated for a set period of time with the contact activation factors such as kaolin, silica or ellagic acid. So during this phase of test, factor 12 produced which cleaves factor 11 to activated 11. So coagulation does not proceed in absence of calcium. So after recalcification, factor 11A activates factor 9 and thus coagulation proceeds. So let's discuss principle briefly. That is, here we are performing the test in vitro, right? So for doing the test, we are using three main reagents. That is, we have already discussed, that is contact factors, phospholipid and calcium chloride. So let me talk about functions of each of these reagents. Okay. First, we are adding the contact activation factors because the reaction is not carried out within the body. Here we are doing an in vitro test. Okay. So suppose if a cut or wound is happening, contact activation factors, that is platelet, initiate the intrinsic pathway, right? So there is no need of external contact activation factors. Here, as we are doing the test in vitro, we are adding the contact activation factors such as kaolin, silica or ellagic acid. So this contact activation factors along with the phospholipid causes activation of factor 12. Okay. So in vitro, we have added contact activation factors such as kaolin, silica or ellagic acid along with the phospholipid causes activation of factor 12. So the activated factor 12 causes activation of factor 11. So the coagulation does not proceed in absence of calcium because the calcium is essential for the coagulation to proceed. So what happened to the calcium present in the patient sample is that here we are using citrated sample, right? Citrated patient sample for the test. So calcium has been removed by the anticoagulant, that is calcium chelation has happened. So calcium will not be available in the patient sample. So we are providing calcium from the outside source. That's why we are using calcium as a reagent. Okay. So now when we add calcium to the pre-warmed patient plasma along with the contact factors, it causes activation of factor 11. So now the activated 11 causes activation of factor 9. So activated factor 9 in presence of factor 8 causes activation of factor 10. Thus coagulation proceeds. Okay, so this is a basic principle of activated partial thromboplastin time. Okay. So now next is procedure, that is collect the sample in a citrated vacutainer. That is citrate causes calcium chelation. So To prepare for most of the hemostatic test, we use citrated plasma, and for a majority of the test, we use platelet poor plasma, because for this test, we don't want platelet to interfere the test. So we need to remove it, or we need to reduce the concentration of platelet in it. So immediately after collecting the venous blood in the citrated tube, centrifuge it at 3000 rpm for at 4 degrees Celsius. Okay. So now after centrifugation, we have got platelet poor plasma and red cells in the bottom. So now for the test, separate the platelet poor plasma which has been obtained. So now we have separated the platelet poor plasma in another test tube for the test. Okay. So now test procedure involves, take 3 test tube, label it as 1, 2 and 3. So now to the test tube 1, add 0.1 ml of patient plasma, that is platelet poor plasma, which we prepared earlier. So now in second tube, add 0.2 ml of kaolin phospholipid mixture, that is contact activation factor, contact activating factor. And in third tube, add 0.1 ml of calcium chloride. So now, as the test is carried out in vitro, we need to pre-warm all these 3 reagents at 37 degrees Celsius for 1 to 3 minutes. Okay. So now after pre-warming, mix the contents of tube 1 and 2, that is mix 0.1 ml of patient platelet poor plasma with 0.2 ml of kaolin phospholipid mixture. And now factor 12 got activated. This activated factor 12 causes activation of factor 11, but coagulation does not proceed in absence of calcium, that I have already told you. So we need to add calcium for the coagulation to get proceed. So we are adding 0.1 ml of pre-warmed calcium chloride to it. Immediately start the stopwatch. So now record the time taken for the plasma to clot. Okay. So procedure. So this is a procedure. Mix equal volumes of phospholipid reagent and kaolin suspension. Place 0.1 ml of patient plasma in second tube. Leave both tubes in water bath at 37 degrees Celsius for 2 to 5 minutes. Add 0.2 ml of pre-warmed kaolin phospholipid solution to 0.1 ml of pre-warmed patient plasma. Then add 0.1 ml of pre-warmed calcium chloride. Start the stopwatch and record the time taken for the plasma to clot. Okay. So the result would be, that is normal value ranges between 26 to 40 seconds. So normal value would be ranges between 26 to 40 seconds. So next is interpretation of the result. So common causes for prolonged PT are, that is prolonged PT means if we have got the patient value more than 40 seconds, that is termed as prolonged PT. Okay. So common causes of prolonged PT are liver disease, that is liver produces majority of the coagulation factors. Okay. So if there is any liver disease, it causes reduced production of certain coagulation factors involved in the intrinsic pathway. So in such cases, as factors are deficient, it cannot causes a clotting of plasma. So one of the common cause of prolonged APTT is liver disease. Second one is massive transfusion with plasma depleted red cells. Suppose if we are transfusing plasma depleted red cells, majority of the coagulation factors are present in the plasma. So suppose if we have transfused a patient with the plasma depleted red cells, he will be lacking certain coagulation factors as the plasma is depleted. Okay. So third one is circulating anticoagulant or inhibitors. That is presence of inhibitors to any of the coagulation factors involved in the intrinsic pathway can causes delay in APTT, or delay in clotting of the plasma or prolongation of the APTT. That is, suppose if the inhibitor is present, it causes suppression of certain coagulation factors, so it cannot act properly. So as a coagulation factor is not acting properly, it can causes prolongation of activated partial thromboplastin time. So next one is deficiencies of coagulation factors in the intrinsic pathway. That is a common, uh, we already know that if there is any deficiencies of coagulation factors in the intrinsic pathway, it can causes prolongation of activated partial thromboplastin time. So next is heparin therapy. So heparin is an anticoagulant which is mainly used to treat some clotting disorder, or suppose if the patient has some clotting disorders, that is, suppose if the bleeding disorders or clotting disorders, such patient would be treated with the heparin. So this heparin causes carboxylation of many of the coagulation factors. So once when the carboxylation has happened, those coagulation factors cannot act properly. So APTT will get prolonged. So last one is vitamin K deficiency. The factors such as factor 2, 7, 9 and 10 are the vitamin K dependent factors, of which factor 9, 5, 10 and 2 are coming under intrinsic pathway. So in case of vitamin K deficiency, those factors cannot get activated. So it can lead to prolonged APTT. So these are the common causes of prolonged APTT. Thank you.